Welcome once again to Antenatal Faith Clinic. If you are seeing me for the first time, I am Nozi, and on this channel I bring interesting topics, any issues at all that concerns women, I discuss them here. If this sounds like what you love to hear always, please click the subscribe button, hit the notification bell so you get notified each time I post. Just like I promised, in today's video I'll be discussing with us one of the methods of birth control. To be specific, the short-acting reversible hormonal contraception. That's the topic for today. It is called short-acting because it is used from day to day, month to month for a short period of time. So I'll be classifying this method under two subsections, which include the hormonal method and the non-hormonal method. We have the combination method, meaning that this method contains both the estrogen and the progesterone. We also have the progesterone only pill. Combination method suppresses ovulation, thereby preventing pregnancy from occurring. And it is 90% effective if you play by the rules of the game. If you use it correctly and properly, it is 90% effective. Basically, the combination method are three. We have the pills, we have the patches, and we have the vaginal ring. Now, the daily oral contraceptive pill is the one that we are all familiar with, right? This pill is taken every day, same time, on a daily basis for 3 weeks. During the 4th week, you have the option to take the placebo or you just rest. The placebo is taken for 7 days, after which you continue the next pack of the daily pill. The placebo is also known as a sugar pill. Some placebo contains iron, folic acid, and other vitamins. Of course, it is arranged in such a way that at that 7 days, it's expected that you're already menstruating. As you are losing blood, you are replacing it by taking the placebo, the iron, the minerals, the vitamins. You know, iron is important in blood formation. Okay, so as you are losing blood during menstruation, the placebo is just there to help the blood loss. It's also important because it helps you to keep track of your daily pills, so you don't forget that you are supposed to be taking these pills every day. Second option is the birth control patch. This patch can be worn anywhere in any part of the body except on the breast. It is changed every 7 days, like every week, for 3 weeks. Then on the 4th week, you rest. You attach a new patch on a weekly basis. Like at the end of 7 days, you remove and attach a new one. At the end of the 2nd week, you remove, attach the 3rd patch. At the end of the 3rd week, you rest so that your body will be allowed to menstruate. After menstruation, you take a new patch. You attach the first one like it's a continuous thing, meaning that for 3 consecutive weeks, you are having your patch on and changed every week. It is only on the 4th week that you are allowed to rest so that you can menstruate, and then you resume again the next month. The 3rd one is the vaginal ring. It is made up of flexible ring that contains these 2 hormones as well, and is inserted by the user into the vagina. In the family planning clinic, you'll be taught on how to insert it properly. But this ring is flexible, something that can be easily inserted, and it is worn by the woman for 3 weeks. After 3 weeks, she removes it so that she can have her menses, and after menses, she gets a new one and insert and continues like that. After 3 weeks, she removes. 4th week, she's free to have her menses, and like that and like that. If this method is prescribed for you, you will be taught on how to insert. Now, what are the advantages of this combination pill? One of the important advantages is that it has a way of correcting irregular menstrual cycle. People who have hormonal issues like excess hair growth, pimple, and all those issues that has to do with hormone, this combination therapy will just help you to correct it. Now the disadvantage of this combination therapy is that it's not indicated for people who have cardiovascular diseases, personal history of stroke, you have blood clotting factor issues. This method is contraindicated for you. This method is also not convenient for women who are above the age of 35 years. If you have issues with migraine or any medical condition that contraindicates you from using drugs that contain estrogen, this method is not for you. So now to the progesterone only pill. I love this pill because it is very convenient for breastfeeding mothers. Like I earlier said, it is also known as the mini pill. It works by making the cervical mucus very thick and viscous. And you know, when the cervical mucus is so thick and viscous, stubborn sperm will be so difficult to penetrate, thereby making pregnancy very, very difficult. In about 2% of people, it also inhibits or suppresses ovulation. Progesterone only pill is taken on a daily basis. It doesn't have placebo or a free period. This is the best option for breastfeeding mothers. Women who are hypertensive can also take this progesterone only pill. However, women using this method may experience irregular bleeding, spotting, change in your cycle, and so on. The non-hormonal method. The non-hormonal method includes the barrier method, which involves the use of the male and the female condom, the diaphragm, which is the only method of family planning that prevents sexually transmitted disease. Have you heard of condom leakage? Do you know that there are people who still become pregnant even after using condom? Don't worry, just stay glued to this channel, because in this channel I'm going to be releasing video on the right way to use both the male and the female condom. Another non-hormonal method is the calendar method, the fertility awareness method. In this method, women track their cycle, that is, they keep record of their fertile and unfertile days so that they can avoid pregnancy during those days that they are highly fertile. And finally, the coitus interruptus, which is also known as the withdrawal method. Well, I salute couples who do this method because it shows that they are highly self-controlled. At the peak of the sweetness, they are, oh God, I salute you so much. But you should note, it is not 100% effective. I've seen people who practice this method and still become pregnant, because sometimes sperm cells may still remain at the tip of the penis, and while doing this method, you think you are safe. Before you know it, your wife is already reading positive to pregnancy. However, for some people, it works. If it works for you, congratulations. The important thing to note while choosing any of this family planning method: what works for Mr. A may not work for you. So I advise you walk into a family planning unit so that you can be properly examined and know the right method that is best for you. And I assure you, when you play by the rules of the game, when you use it correctly, you stand a chance to be part of the percentage of people who are lucky to escape unplanned pregnancy. If this video was interesting to you and you love what you heard and you still want to hear more, because I'll keep releasing new videos every week, please click this subscribe button, hit our notification bell so you get notified each time I post any videos. Thanks for listening.